All right. Hi, Nina. Thank you for coming in. Um, and I'm really happy you were able to reach out to our agency and get some of that paperwork done beforehand, so we're ready to go as you come in and get to know each other a little bit. Um, I always like to say it's the first meeting is a good opportunity to, like I said, get to know each other and understand if we're going to be a good fit going forward. Because it has to be a good fit, or else we want to make sure it's productive for you, and that I understand what you need, so I can kind of support you in that, right? So yeah, like I said, this first opportunity will be a good chance for us to just um, go over some of your background, and then some of the reasons that bring you in today, so that we can get started on just started on working on some of your goals and stuff. Does that sound good?
Yeah, that sounds good.
All right, perfect. Okay, cool. So, like I said, you were able to fill out some of the paperwork, insurance form information, so we should be good to go. Um, so yeah, basically, I like to start, just give you an opportunity. What are some of the reasons that bring you in today? What made you want to reach out um, for some therapy? Do you have any goals in mind? What are some of the reasons that brought you in?
Um, I guess like anxiety about like school and keeping like track between like schoolwork and other stuff.
Hmm. Okay. And now, you're in school full time? Are you do you do it online, or you go in person? How does it work?
It's online and yeah, it's full time.
Great. Okay. So yeah, you must be pretty busy. So I can imagine that can create some stress, especially when you're trying to
Yeah,
balance out other aspects of your life that you don't want to let go of, and maintain a life. Basically, we all want to have school is good. It pushes us forward, and obviously you have your reasons for enrolling and all that, but you want to keep part of your life then, so you can continue after school, basically. So that's good. So do you work while you're in school? Do you have employment too? So I'm just trying to get an idea of how what your day to day looks like.
yeah. I also work while I'm not in class.
Okay. Okay. Cool. And is that full time as well?
It's part time.
Part time. Okay. Yeah, that makes sense. But like I said, when you're in school full time, and um, that takes up a really good amount of time. So between homework and meetings and class time and all that good stuff, especially at this level, it takes up a good amount of time. So balancing anything else, including work, I'm sure it takes up. I'm sure you're very busy. So I admire you for pushing forward, and wanting to do school while at the same time. That takes a lot of effort and strength, I would say. So that's great. Great. So what are sort of some of the things that um, make you anxious? I know we mentioned maybe it takes up a lot of your time. Is there anything in particular that makes you anxious when you're doing the schoolwork, or is it kind of a week to week thing where you feel overwhelmed?
I guess week to week because it depends on like how much homework I have, and
Mm,
if I have a lot, then I feel like I can't get other stuff done. Yeah,
great.
so I guess it depends.
Yeah, that makes sense. Um, yeah, and I'm sure it goes up and down based on, like you said, what assignments you have for the week, and when you're working and on different things. So I'm sure it takes it's a new adventure every week, I'm sure. So that's good that you're right. You're able to recognize that it does fluctuate, I'm sure, but that's totally normal, to have some anxiety about that. you know, to struggle with that on a week-to-week basis, because you know, especially if things aren't always the same every week, you can get into, it's hard to get into a rhythm, I'm sure. So so yeah, definitely that's definitely a lot of effort for you. So I definitely but yeah, I think it's great that you were able to come in. So as a reminder, I did want to, you know, remind you, you know, this is an opportunity to open up, and you know, I'm glad you're able to come in, talk about some of your anxieties with school and the rest of your life. But yeah, so this is an opportunity. I did want to remind you, this is entirely confidential. You know, I'm in a closed environment. I know we're doing this over telehealth and Zoom, but I have my headphones on, closed environment. So just wanted to make sure you knew that when we're talking, and you do have the opportunity to trust me, that no one else will be involved. So yeah, I hope that is does make you feel a little bit more comfortable coming in. So but great. Okay.
Yeah,
So yeah, awesome. Great. So is there anything else, you know, I know we mentioned anxiety. Is there anything else that comes along with it? You know, any sort of behaviors? Do you feel like maybe it's hard to get some schoolwork done on a week-to-week basis? Any signs of maybe depression that are preventing you from moving forward and getting through that week to week?
maybe a little bit, but not as bad.
Okay, so a lot is mostly anxiety that's driving you to come in and chat about this. Okay, great. Now, have you ever sought therapy before in the past? I know you're in school now. I'm not sure if you have been in the past, or have had to balance this type of workload in the past. Have you ever been to a therapist before for anxiety?
No, it's the first time.
This is the first time. Okay. And have do you feel like has this been was it a difficult decision to try to reach out and seek therapy? I know it can be a lot of people, for their first time, it can be challenging to open up to someone they don't know, especially for the first couple of meetings. So have you ever thought about doing therapy before? And if so, has anything prevented you from enrolling or doing anything to seek help?
Um, yeah, I thought about it before. Um, I guess I just didn't want like other family members to worry.
Okay. Okay. That makes sense. So you mentioned family members. Does anyone do you feel like anyone else in your family has been worried about you? Or has said anything to you that maybe they feel like they've been concerned about you?
Um, nothing really in particular.
Mhm. Okay.
Yeah.
Okay, that makes sense. So you kind of maybe your anxiety has gone under the radar to where people haven't noticed too much. Okay,
Yeah.
but that makes sense. So it's affecting you to the point where no one said anything, but you still feel like it would be beneficial to reach out for some help. So
Mhm.
okay, that makes sense. And have you ever? I know you actually haven't been to therapy. Have you ever been diagnosed with anything before? Anxiety, depression, suicidal thoughts, anything that you've mentioned to maybe your primary care doctor or another doctor?
Not that I know of.
Not that you know of. Okay,
No.
so you have not taken any medication or anything that prescribed from a doctor. Okay, that makes sense.
No.
So it sounds like you know, you're dealing with some anxiety regarding school, and this is, you know, your first time you're able to, you know, reach out um, to get to a point where you feel like you need that help so you can improve and improve your life on a day-to-day basis. Um, was there I would guess I would ask, is there a moment where you felt sort of a peak of that anxiety where you you were like, that's it, I gotta go see someone because it's just overwhelming too much? Was there sort of a moment that peaked for you?
Um, yeah, probably when I had like 3 different assignments due on one day, and the same day I had to work for like 6 hours.
Oh wow! So that was a absolutely full day that you had to sort of navigate how to get through. No, no. How did you get through that day? Did you I know you had to work, so obviously you had to show up for that. How was that navigating and getting those three assignments done?
Um, it went okay, but I definitely didn't like do as well as I could have.
Yeah, yeah. Did it sort of come down to the wire as far as getting
Yeah,
things in on time? Yeah.
yeah,
Okay, that makes sense. So, like you said, with a pretty much a full day of work and three assignments to do, that can be a lot on your plate to take care of and you get in on time. Maybe things were due at midnight or something. You kind of had to nail all that down, and but that's a lot, and it can take away from. I know I've talked to some other people, that are in school, and I know it can maybe take away from doing your best at the schoolwork to, um, you know, put your best foot forward because you're so busy. You kind of just gotta, cram all that in, and sometimes you don't have time to really flesh out the assignments or you know, do your best work in a right. So yeah, that's good. I'm glad you recognized at that point that maybe maybe things were getting too much for you, and that you know maybe there's a better way to navigate and get some help to help you move forward and maybe create a better balance between the two. So that's great. So like you said, you've never seen a psychiatrist or a therapist before?
no, I
No.
haven't.
Okay. Okay, great. Have you, and again, like you said, I asked you before, you've never been administered any sort of psychiatric medications, um, even including ADHD medication, anything that has helped you in the past?
No.
No. Okay. So this is really, really the first time that you're
Okay.
seeking any sort of help, um, and seeing what you can do to um, to do that. Have you ever thought about going to? Have you ever had a feeling where you were like, I know we're meeting now. Have you ever had a feeling like maybe I should make an appointment with my doctor to talk about that? Any sort of medication or anything, or kind of reaching the point now where therapy was your first intuition?
Yeah, therapy was the first choice.
Yeah. Okay, that makes sense. So it's sort of maybe let's talk it out first before um,
Yeah.
we jump to any sort of medications or talking to my doctor about it. Yeah, that makes sense. All right, perfect. All right, perfect. And I asked you before, no history of suicidal ideations, anything in the past. I know you reached that point. On that day you had a lot of homework and things like that, but it more of a just overwhelming feeling of anxiety rather
Yeah.
than that. Okay, all right, that makes sense. Great. So as far as is I know you mentioned this is sort of your first time in therapy and reaching out for any sort of help. Has there, as far as is there anyone in your family that has had any history of uh, mood disorders, anxiety, trauma, any sort of substance misuse, anxiety, depression? Anyone in your family or close ones at all that have had anything?
Um, Not my immediate family, but I don't know a lot about like extended family history.
Hmm. That makes sense. Have you ever noticed, anyone's? mood maybe not being in the right place as you were growing up. I know, um, sometimes we don't talk about that stuff with our parents or our siblings. But any sort of thing that you can remember that may have that can jog your memory as maybe there was something going on, and I wasn't sure. Anything that pops into mind?
I think more with like extended family.
More extended family, so maybe
Mhm.
at a gathering or something like that.
Yeah.
You've seen a few things that maybe you were like, oh, maybe there was something going on with them that wasn't, maybe they weren't feeling the best or something like that. Okay. Um, okay, great. So that gives me a good idea. So it sounds like, you didn't notice anything growing up, as far as anxiety, depression from your immediate family, but maybe some stuff on the peripherals of some extended family and friends. All right, great. So, next thing I would want to ask, do you have any history with drugs or alcohol? Do you currently drink or use any substances? Um, and then I would follow up with how often that would be and see, if that would have an impact.
Um, I drink some, but just like on occasion.
Okay. And is that um more of a social thing, kind of hanging out
Yeah,
with friends or at a
yeah,
gathering?
a
And
social
and
thing.
and, and what kind of thing what sort of drinks do you usually have when you do have those occasions? Is it more of a just a beer or a seltzer, or is it more of a harder alcohol like a shot of vodka or something?
Usually like a seltzer.
A seltzer, so pretty light.
Yeah.
Okay, so sort of, if other people are having some, you'll have a seltzer here and there. Okay, so you don't feel like alcohol is it's not a day to day use thing at all. It's not you don't feel maybe it's not contributing to your anxiety at this point at all.
Yeah, I don't think so.
Don't think so. Yeah. Okay. So is this more of a social thing? It definitely might not be. As far as, because if it was more of a daily thing and you're have to have a drink and you're balancing school and work, and that could definitely contribute. So that is good to know that it's not a daily thing. It's more of just a get-togethers type of thing. So great. Perfect. So and you said no substance use at all, any even marijuana or anything like that?
No.
No. Okay. And all right, perfect. Um, Great. So no history of that. Um, and did you start? When did you first start having alcohol? Maybe
Um,
sort of in college, or was it a little earlier or later?
a little after I started college.
Okay, so that's a pretty normal age. So it sounds like that's not going to be a major concern or anything that would contribute to anxiety. So that makes sense. All right, perfect. So great. So just a little bit more about your family. Where did you grow up? How many siblings did you have? Did your parents ever experience a divorce? Or yeah, just give me a quick rundown of how your family structure was.
Um, I just have one sister,
Okay.
and I grew up with both of my parents and her. I didn't witness a divorce. Um, yeah, it was a pretty smooth childhood.
Okay. So you had two parents, and they've been together your whole life. and then you had the one sister. Did you get along with the sister growing up, or and
Yeah.
your parents? Did you feel like you had one that you were closer to, or did you seem to have? I know you mentioned probably a pretty smooth childhood. Was there anything that you can think of that you got along with them, or you didn't at certain times?
Um, I think we all got along pretty well.
Mm.
Yeah, nothing too out of the ordinary that I can think of.
Okay, cool. And were your parents around a lot? Were they kind of had normal jobs where they got home at night and saw you guys, or was there any sort of unique situation where either of them were in the military or anything like that, or it was more so they were around a lot?
Um, they were around. My mom was stay at home, but then my dad went to work and
Mhm.
would then come back at night.
Okay, so maybe you spent a little bit more time with mom.
Yeah.
You and your sister did probably as you were
Okay.
growing up. That makes sense. Um, do you feel like that affected you in the past, or you felt a little closer to your mom, or vice versa, as the things went along?
Not that I can think of.
Okay, so you kind of had a sort of a balanced relationship with them and
Yeah.
your sister. You said, okay,
Mhm.
great. Is your sister younger or older?
Older.
She's older. Okay, so you're the youngest. Okay,
Yeah.
so that's definitely a role that is different. I know I'm the oldest, and it can be uh, a totally different role as you're growing up. You kind of get more responsibilities, or different responsibilities as you're growing up, and have your different roles here. So I know I'm one of three. I'm the oldest. There was always a little bit of a difference between the middle and the youngest. So, but that makes sense. So, and how much older is your sister?
5 years.
Okay, okay. So that's a decent gap. So you had
Yeah.
a little bit of a gap there, but you felt like you hung out growing up, or you felt a little at least a little bit close growing up.
Yeah.
Okay, all right, cool. Um, all right, great. So if you like you said, you kind of had a balanced childhood, pretty stable. If there was a time, and I know this is your first time going to professional, but if there was a time where you were dealing with stress, and you know you really needed help, you were freaking out, or really on the edge here, what is there someone you would first go to for help? Maybe I need to talk to my mom, or is there someone that you can think of that was kind of your point person?
Yeah. Probably my mom.
Okay,
Yeah.
okay. So that makes sense. So if you had an issue, you would go to your mom, and you felt like maybe she gave you good advice, or it was sort of sort of a safe environment to talk to her, or as a first resort, I guess.
Yeah.
Okay. Um, yeah, and that makes sense. A lot of time, I know I was close to my mom too, and parents play different roles too. You go to I feel like sometimes you go to one parent for one thing and one for the other type of scenario and situation. So that's good that you had, someone, you had your mom that you were relatively close with, and you could, balance that out and check in with her when you needed some assistance there. So that's great. Great. And any history? I mean, it sounds like had your pretty balanced childhood. Any history of um, you know any type of abuse at all, verbal, physical, anything like that?
Not that I can think of.
Not that you can think of. Okay, okay, good. Well, that's good. Sometimes people repress that type of stuff, and it can come back as they get older. So, but it sounds like that's not the case. You seem to have a good relationship with both your parents, and things were kind of okay there. So, great. Okay. And yeah, so it sounds like everything's going good. So basically, you're in school now, and where do you work?
I work with horses.
Oh, interesting. What do you do with them?
I train them.
Oh, really? Cool. Do you do like do you do shows or anything like that?
Yeah, sometimes.
Oh, very cool. I grew up in a small town, and we had a couple of farms that were like up the road and stuff that had these giant stables. And I always thought they were really cool. Um, just to look at. I feel like, I don't know, it's so cool that had these large I guess you would, I'm not sure if you call them like tracks, where the horses go
Mhm.
around and stuff. I thought it was really cool. So that's awesome. And then you're in school sort of progressing in that right as well. So okay. So cool. So it sounds like you're doing something that you like. Did you grow up with horses or?
Um, I started riding when I was young, but I didn't like grow up with them,
Okay, so you
if that
so you
makes
rode
sense.
them, learned how to ride them maybe, but you didn't have any horses at home or anything that
Right.
you grew up with. Okay, cool. So it sounds like you're you're pursuing something that is you're pursuing something that is something you like a lot. Does that sound accurate?
Yeah.
Okay, cool. And do you feel like you have goals for when you're going to be finishing school? Do you feel like that's going to change? And would you like to keep working with horses in some capacity as well?
Yeah, I would like to.
Okay, cool. Um, so that makes sense. Cool. Well, it sounds like you're. It sounds like this anxiety is coming from you're working. You're working a lot. You're doing something you like, but um, you wanted to pursue another field and progress maybe in your schoolwork as well and in your career. So it can be it's absolutely a lot of work to um, join school. I'm not sure how long. Do you know how long exactly? You're in a master's program, correct?
Mhm.
Okay, so how long after your undergrad did you start school or start thinking about going back to school?
I started the same month that I graduated undergrad.
Oh, okay. So you were ready to go. You were
Mhm.
thinking this is for me. I'm gonna get going. But yeah, okay. And did you feel like you have some of the same stressors in undergrad, or is this sort of a new territory with about having to work too and balancing that out?
Um, I think it's a little new because it's a new school, but
Yeah.
yeah, other than that, pretty similar.
Okay. Okay. So school and balancing the rest of your life seems to be a sort of a pain point and a stressor for you in the past as well. So that makes sense. So yeah, I mean, I think what we should do, I mean, and I think this was a good opportunity to learn, where you come from, what your family life was like, and what's kind of um, become the big stressor for you now and why you've come in. So this was a really good opportunity to get to know you in that realm. So yeah, like I said, if you what I'd like to do, and I hope this was a good opportunity for us to interact and get to know each other as well. Well, I really would like to meet with you again and kind of work on some of those skills to balance out you know balance out that anxiety to where you got to do school, you got to continue working on that schoolwork while you're still living your life and working and doing the rest. So yeah, I mean, if that's something you're interested, we can absolutely meet again. That of course, that's up to you based on how this meeting went and everything. But we can definitely do that in the future if that is something you're interested in.
Yeah.
Okay, cool. Yeah, so so like I said, thank you for coming in today. You know, I'm glad we were able to have this conversation and just kind of get to know each other. But yeah, we can totally set up another appointment. I'll have you go to the front desk and we'll set that up. You know, for a time that works for you. And then, like I said, we'll work on some of those skills to kind of balance out and give you some opportunity to grow and work on some of those anxieties that you have with balancing school and the rest of your life. Okay.
Okay, thank you.
Awesome. All right, cool. So like I said, we'll wrap up here. But it's a great opportunity, and I'm really happy you were able to, you know, step in and say that you needed help, and you're able to come in and talk with me. So I think you have all the tools, you know, to move forward and grow. So I think we can work on those together as well, and get somewhere and help you out with your anxiety. So yeah, thank you for coming in. You know, again, this was a confidential, you know, everything's confidential within our discussion, and we'll maintain that going forward. So but yeah, if you want to schedule at the front desk, we will see you another time. All right. All right, great. Thank you so much. All right, bye-bye.